The human elbow is designed to perform numerous daily tasks. And once you begin experiencing pain from arthritis, it's time to seek medical intervention. We asked Dr. Andrew Wong of Redlands Community Hospital in Redlands to explain the symptoms and the current treatments available.
Specifically talking about elbow arthritis, there's a couple different criteria that I use when telling patients that, you better come and see me. One is pain. So arthritis of the elbow can cause pain. It can cause a diminished amount of motion as well, and that's really the second criteria that I use. Range of motion of the elbow is very important with using your hand. And so once we get to that point where patients aren't really able to use their hands and their elbows appropriately, that's a really good reason to come see me. Really the mainstay for diagnosis for elbow arthritis is plain x-rays, which we can get right in the office. And that's really the best way of diagnosing elbow arthritis. So really with most orthopedic problems, we always begin with non-operative treatment first. We try and do the things that are least risky to the patient and work forward from there. So when someone comes in with a problem of the elbow, really we try and do activity modification. So if they have arthritis or tendonitis or some other problem around the elbow, really what we do is to look at what they do day to day, what kind of things bother them, and think of ways we might be able to change or modify the activities that they perform. A lot of times that can get their pain level diminished and can help them to live with their elbow in a more comfortable manner. From there we can give oral medications, anti-inflammatory medications, there's splinting, and then finally there's injections, and that's by putting medication directly into the elbow joint we can get some of that inflammation and pain down.
When do you start treatment of arthritic elbow?
So when patients come to me and they say, my elbow is too painful, I can't sleep at night, I can't do the things I want to do, it's changing my life in a way that I don't want to. Or when they say that I can't use my elbow anymore, so they have a diminished range of motion, an inability to really use their hand and elbow efficiently, then that's a point where we really need to start talking about surgery. So there's really different types of surgery that can be performed, and that really is tailored to the patient. So in a young patient who has a lot of wear and tear in their elbow, usually the main problem is lack of range of motion. There's one patient that I can recall that was just 17 years old. He was a high school pitcher. Had put a lot of wear and tear over his elbow, although he was only 17. And his main problem was that he could not get his elbow straight and he couldn't bend it up. So for something like that, we can go into the elbow joint either through arthroscopy, which is surgery through several small portals. We put a camera inside the joint and have another portal that we can use instruments to work inside the elbow. Or else in other instances, we'll make a small incision on the outside of the elbow. And what you do is you go into the elbow joint, you remove some of those big bone spurs that are blocking motion. You can cut the capsule, and really that can restore quite a bit of motion for these patients. In older patients, as they get more advanced arthritis, those options are a little bit more limited. And when they get to that point where their elbow is just so painful, we can do what's called a total elbow arthroplasty or an elbow replacement surgery.
What is the success rate of postoperative elbow surgery?
And really in the last 10 years we've made big advances in our knowledge of the elbow. It's a very complex joint. And so I think we're getting more and more successful, and with each year these prostheses that we use are becoming more and more well tailored to really what we need them for. We have higher technology and better ability to use them. So in the example that I was talking about, total elbow prosthesis or elbow replacement, a lot of the studies that we have now show really excellent reduction of pain in patients between 72 and 90% of the time.